Your foot falls asleep on the couch. You stand up, and it takes a few seconds to wake up. Or you're driving, step out of the car, and your leg feels heavy. Tingling, numbness. That pins and needles feeling, like your sock is bunched up inside your shoe. But it isn't. This is very common after 50, 60, but common doesn't mean harmless. Today, I'm going to show you 5 simple and safe exercises, the same way I use them in physical therapy, that you can do every day, no equipment needed, which help a lot when this sensation is linked to posture, stiffness, nerve sensitivity, and slower circulation. And we're going to do this the right way, safely. Keep this rule in mind. Light effort is normal. Sharp pain or increased numbness is not. Now, and don't forget to subscribe, because here, I always bring simple explanations and practical exercises. Before we get into the exercises, let me explain in a simple way what's usually behind this, without scaring you. In practice, there are 3 very common causes I see in the clinic, especially after 50 or 60. The first is increased nerve sensitivity due to posture. When you sit for long periods, slouched with a rounded spine or with your legs crossed, it's like you're bending the path of the nerve. Most of the time, it's not serious, but it's enough to cause tingling or numbness. The second is slower circulation, and here's something many people don't know. Your calf works like a pump. When you move your ankle, you help blood flow back up. When you stay still for too long, that pump basically shuts off. And that's when you get numb feet, heavy legs, that strange sensation. And the third point is stiffness. When your ankle and hip become more restricted, your body starts to compensate, and everything gets tighter, both for movement and for the nerve itself. Now, an important point. If this is new, getting worse, or happening frequently, it's best to check with a doctor, because tingling can have different causes. But when it's related to these more common factors, your body usually responds very well to the right kind of movement. And while you're here, if you like this kind of content, make sure to subscribe. I always bring simple, safe, straight-to-the-point exercises, especially for people who want to keep moving well after 50 or 60. Now let's begin. The idea here is simple. We start sitting, waking up circulation and loosening the body, then move to standing with support. This sequence takes about 6 to 8 minutes. The goal is not to get tired. It's to finish feeling your legs lighter, more awake, and less stiff. So let's start. Exercise 1. It looks simple, but it makes a big difference, especially if the tingling shows up after sitting for a long time. Couch, chair, car. These are exactly the situations where your leg starts to switch off. Sit on a firm chair, feet flat on the floor, hip width apart, spine upright but relaxed. Now you're going to do a very simple movement. Raise your heels, lower them, and lift your toes. It's a back and forth motion. But here's the detail that makes this actually work. Go slow. No rapid foot shaking. When you move slowly, you activate your calf better, which is the main pump for circulation in your leg, and also the front of your shin. And that already starts to wake up your leg. A very common mistake is moving the whole leg, swinging the knee, the thigh. You don't need that. The movement happens at the ankle. The rest of your body stays relaxed. If it feels too sensitive, you can use a smaller range of motion. But keep it controlled. Do 15 to 20 slow repetitions. And pay attention to the sensation. It's common to feel a slight warmth, like your foot is coming back to life. That's a good sign. But if the numbness increases or feels off, reduce the range or stop. Exercise number 2, seated marching. This one starts to wake up the whole leg, not just the foot, but the thigh too. It's especially helpful for people who feel their leg is heavy when they stand up, or notice it takes a few steps before it really kicks in. Stay seated. Sit taller, with your feet on the floor. Now you're going to move as if you were marching, but slowly. Lift one foot a few inches, lower it, then lift the other one. Alternate sides, like a gentle march in place. But here's an important detail. Don't do it fast. Most people do this on autopilot, but what really helps is control. Lift. Hold for a moment, then lower slowly. This activates the leg muscles, improves circulation, and starts to reorganize the movement pattern. Another point, try to keep your torso steady. No swaying side to side or throwing your body around. The movement is in the leg, not the whole body. If it feels easy, you can lift your foot a little higher. If you're more sensitive, just lift it slightly, barely off the floor. Do 10 to 15 reps on each side, and notice how the leg starts to feel more present, lighter, more awake. Exercise. Number 3. Gentle nerve glide. Now the third exercise is one of the most important when the tingling comes with that stuck or sensitive leg feeling. This is not a deep stretch. It's a gentle movement to help the nerve move better. Because many times the issue is not just circulation. It's also the nerve becoming more sensitive after too much time still or in poor positions. Stay seated. Sit taller without stiffness. Now do this. Slowly straighten one leg, and at the same time, gently pull your toes toward you. Hold for a moment, then return with control. Then repeat on the other side. The movement here needs to be gentle. The goal is not to force anything. It should feel more like you're helping the nerve glide. And that's the most important detail. Don't try to push to the limit. If you force too much, you can irritate it even more. Here, less is more. Another important point, don't stiffen your whole body. Don't hold your breath, and don't throw your torso backward. Keep everything relaxed and natural, letting the movement happen smoothly. If you're more sensitive, use a smaller range. You don't need to fully straighten the leg. Do 8 to 10 reps on each side. And pay attention to how it feels afterward, because many people notice the leg feels lighter and less stuck right after this exercise. Exercise. Number 4. Weight shift plus heel raise. Now we're moving to standing. This exercise is one of the most helpful when the leg feels heavy or slow to wake up after you stand. It works on two things at the same time: circulation and control. Stand behind a sturdy chair. Keep your hands on it just for support. Feet on the floor, hip width apart. Stand tall without locking up your body. Now start with the weight shift. Slowly shift your weight onto one leg. Come back to center, then shift onto the other. It's a small, controlled movement. Once that feels comfortable, add the second part. After shifting your weight to one side, raise your heels so you come up onto your toes. Hold for a moment, then lower slowly. Come back to center and do the same on the other side. The most important detail here is on the way down. Don't let your heels just drop. Lower them slowly. That's what activates the calf more effectively, which directly helps circulation in the leg. A common mistake is leaning your body too far to the side or forward. Try to keep your torso aligned and the movement controlled. If it feels more difficult, just do the weight shift without rising onto your toes. If it feels easier, you can do 2 heel raises before switching sides. Do 8 to 10 reps on each side, and notice how the leg already starts to feel lighter and more active. Exercise. Number 5. Controlled sit to stand. This is the most functional one of all. It's a movement you do every day, and when it's done well, it improves circulation, strength, and confidence all at once. This exercise helps a lot when your leg feels heavy or slow when getting up. Use a sturdy chair. If possible, place it against a wall. Sit near the front edge of the seat without sinking all the way back. Now adjust your feet. Keep them flat on the floor, hip width apart, and slightly farther back, more underneath your body. From here, lean your torso slightly forward and stand up. Rise until you're fully standing. Then lower yourself slowly, with control, until you sit down again. The most important detail here is this. The movement starts at the hips. When you lean your torso slightly forward and push through the floor with your feet, you distribute the load better and protect your knees. And the lowering phase is just as important as the lifting phase. No dropping into the chair. Lower yourself over 2 to 3 seconds. A common mistake is placing your feet too far forward. That increases the load on the knee and makes the movement harder. Bring your feet a little farther back before you start. If it feels more difficult, use your hands for support. If it feels easier, do it without support and hold the standing position for a second before sitting back down. Do 6 to 10 reps with control. And the goal here is not to get tired, it's to finish feeling more stable, with your leg responding better. Now let's turn this into something simple to apply. For 10 to 14 days, do this sequence once a day. It only takes a few minutes. Keep the same order you saw here. Start seated, wake up circulation, and finish with standing movements. If you notice your leg feels lighter, the tingling happens less often or fades faster, keep going. But if it gets worse, becomes stronger, or happens more frequently, then it's best to get it checked out. And one small detail that makes a big difference: breaks. If you spend a lot of time sitting, try to get up every 30 to 45 minutes, even if it's just to take a few steps or do the first exercises for 30 seconds. That already helps a lot. Now tell me in the comments, have you been feeling this often for a while, or did it start recently? And if this video helped you, subscribe to the channel. I always bring simple, safe, straight-to-the-point exercises, especially for people who want to keep moving well after 50 or 60. See you in the next video.